Susan is a Jewish middle-aged female who mostly follows a kosher diet. She presents with chest pain and shortness of breath, along with her history of hypertension and hyperlipidemia. She may have acute myocardial infarction and has received a left heart catheterization along with a coronary angiography and left ventriculography, and she also received a stent. Looking at data to collect, it is noted that she does walk on a weekly basis, but it's something that I would like to know is the length of her exercise and what her schedule is like, being that she is a professor as well as a grandmother with 4 grandchildren. I would also like to discuss how her health and diagnoses have impacted her life and hobbies, including her photography. Thing that would also be helpful just in regards to information related to her nutrition would be to receive a 24 or a 48-hour dietary recall to best understand and get an idea of what Susan's typical daily intake looks like, to best evaluate her status as well as her nutritional status, to make sure that we're implementing the best plan possible for her. Other data that pertains to nutrition that would be implemented within her intervention is noting that she does try to follow that kosher diet. It's important to acknowledge her beliefs, but also to better understand her standards and how important following a kosher diet truly is, along with any other specific dietary or life practices she follows to align her plan and best fit it to her needs. Now, my PES statement that I have specifically for Susan is acute myocardial infarction related to chest pain, tightness, and shortness of breath, along with abnormal appetite, as evidenced by abnormal ECG with abnormal heart rate and rhythm, as well as the need for a stent and catheterization. And looking at her nutrition prescription, I would like to discuss a heart-healthy diet that can help reduce her blood pressure for her. Also discussing goals of lessening her medications. She's on medication for her hyperlipidemia as well as her hypertension, so to be able to remove her off those medications could make a big difference for her life. She should be recommended to have a low cholesterol, low fat diet to also decrease that hyperlipidemia, as well as implementing items that will also assist with her osteoarthritis. The DASH diet is something that is rich in potassium, calcium, magnesium, fiber, and protein, as well as low in saturated fat, low in salt. These are some things that I would recommend for her in regards to her diet. For her intervention, I would also lean more toward nutritional counseling to create an action plan and empowering her to have more of a role in her prescription to treat and promote better health within her current conditions and diagnoses. As a Jewish woman, it is important to acknowledge her beliefs and only implement what aligns with her. This is what comes down to cultural competence, is to really acknowledge where she stands in regards to her beliefs. Obviously, she is not following a strict kosher diet, but to kind of see where she falls in regards to that, and also any other items that we may need to take into consideration when doing her intervention. This means truly listening to what she is comfortable with and how much of a role her religion has within her life and what she practices in order to best assist her in determining a goal and creating the best route possible for her success as well as her intervention for nutrition goals. I chose this infographic for Susan because it is great ways to improve her heart health, not only with regards to her acute myocardial infarction, but also in regards to her hypertension. It is important for her to cut down on her salt intake as well as her added sugars, along with minimalizing her processed food intake. This infographic also emphasizes the increased physical activity to improve heart health, along with including a variety of fruits and vegetables, choosing whole grains, and including healthy protein sources. While Susan's alcohol consumption is low, it is important to note that it also states to limit her alcohol intake. Lastly, when it comes to nutrition monitoring for Susan, the best way to monitor her would be through her ECGs. This, of course, is how we were able to signify any abnormalities when it came to her heart health, but again, also through nutrition quality of life. This means implementing different and variety of nutrition items to make sure that we're able to maybe potentially remove her from those medications, and that can ultimately better her overall life, and then again help her through her future years, as she is still young when it comes to being middle-aged, and she has grandchildren that I'm sure she would love to see grow up, and so just feeding to those pieces, but again, that quality of life is a big deal.